Hey guys, welcome to your Power Hour. I'm super excited that you're here. This has been a really big topic. We've had a lot of people registering. We're doing it twice this month. You might be at the first time or the second time that I'm giving this, but welcome. I'm super excited that you're here. Can you let me know where you're zooming in from? And let me know, are you a dentist, a hygienist, office manager, dental assistant? And I'd love for you to interact. This is all about you. At the very end, we're going to have a Q&A. And if you're not watching this live, please feel free to email me your questions. I am at admin, A-D-M-I-N, at dentalpracticesolutions.com. And you should have that information at the bottom of your handout. I hope you have your handout printed. And as we go through your Power Hour, take copious notes. This is the easiest way to implement. Well, I shouldn't say easiest because you have to find time to meet with your team. And your team needs to sit down. You need to print this out and take them through this, walk through it. There are some things here that you can take back and practice with your team. Now, I know that's difficult. So I have some ways that you can choose to implement this. It's not free, but it's going to be at the end of your handout here. And you can get an opportunity call with me. I'm happy to help you for like 15 minutes and see how we can get you moving. Most of our clients, and I'll tell you again at the end, I just was trying to find my own coach. I always have a coach. And they were telling me that I probably need to charge more money because our clients do get 25% ROI on what they do with us. So you can go to our website, dentalpracticesolutions.com, and check that out. But I digress. Let's get going here. Okay, great. I see we've got people. You guys are located. Where are you located? You are we see Boston, New York, and I see Seattle. I see Oregon, Westland. I see Denver. I see British Columbia. I see Newport Coast. Thank you so much for being here. And it looks like we have a lot of doctors here. So I love when the doctors are here because you guys are the leaders. You're the ones that are the inspectors. You tell your team what you want. And then your job, what I teach is that your job is to inspect what you expect. And now this is to be given to your team so they know what you expect, doctor. And let's get to it. Why is this even a important topic? At the beginning here, I'm outlining this for you because I look at KPIs, I look at data from all over the United States. I read about it. You can read about it too if you want, but it might put you to sleep. That's what I love. And I'm going to tell you that 50% of new patients that go to a dental office, they do not return for at least 18 months. A lot of them, we know that they leave having to think about it. They're not sure that they want to come back. And what can you do differently? My goal is that after today, you've got some tools in your tool chest that you can have patients leave feeling like, wow, that was the best experience I've ever had in a dental office. Have you ever said that? I mean, I don't live near Nordstrom, thank God, but I loved shopping at Nordstrom because I love the way the people made me feel. One time, I don't know, you can go to my YouTube channel, which is under Dental Practice Solutions, and you'll see if you sift through all the YouTube videos. But I went undercover to a dental office that was corporate. It was maybe 10, 13 years ago. And it's a video that got a lot of views, a lot of traction on this video I did. Because when I went to this corporate office, it was $59 I paid to be a patient. I told them I was a fitness instructor. I went undercover. Remember, I wasn't lying, but I just wanted to experience it. I have to tell you guys, it was the most phenomenal. It was the best experience I've ever had. So it kind of changed my mind on corporate dentistry many years ago. And it's all about if we have a system laid out like this is your system, part of your system for new patients, and everybody is expected to do this, and doctor, you're inspecting and checking in that they're doing this, everybody benefits. Your patient gets an elevated service of care, and you get a day that's like yoga or Zen, not a migraine headache. And everybody loves what they're doing so much more. It costs you so much money to get a new patient. So that's another reason why I put this together. And today I'm going to share with you my secret sauce to get patients on your website and easily schedule their new patient appointment. Now, also, this is an important topic because you want patients to keep coming back. And why else do you think, you fill in the blank, why else do you think this is an important topic? How much are you spending on marketing? Let me tell you guys, this is some other data that you need to know. You need to have a patient base of at least 1,500 patients. The majority of offices that reach out to us have less than 1,000 active patients. What is an active patient? An active patient is somebody who's come for at least one appointment in the last 18 months. Now look at that number. I challenge you, doctors, you're here. Go to the person. There should be a person that you can go to, one of your employees, who you can look at this data. Now we use Dental Intel, and you get a free snapshot. It's 1 month where I can show you these numbers. And I invite you, if you don't know these numbers like that, you can get a snapshot with Dental Intel if you have Dentrix, Eaglesoft, or Open Dental. So I can show you these numbers because you need to know them. Numbers tell a story. And let me show you what happens. See, 10% of your patients annually, this is another piece of data that I know. In the United States, 10% of your patients either die, they move, or their insurance told them to go somewhere else. Now, I hope that they come back to your office. And if you made them feel like this is the best office they've ever been to, maybe they're not going to go somewhere else that their insurance tells them they'll get the things paid for. And by the way, that's another story, another conversation, another training for you on, how to talk to these patients who are driven by what their insurance pays for. But let's talk about attrition. So you have 1,500 patient base, right? You've got that, right? If you don't, let's do something about that. I mean, I'm not going to charge you for it. I want to make a recommendation, schedule the 15 minutes. I want to make a recommendation of how to get to 1,500 patients as soon as possible, because you're going to lose about 150 of those patients aren't going to come back between 2024 and January of 2025. Now, let's just say you have 100 new patients that come in annually over the next 10 years. So your patient base at the end of this year it could be 900, because maybe you could lose 150 and not have any new patients. So, by year 10, you definitely got maybe 900. But 100 a year, you lose 100 patients a year, and you don't get more than 100 new patients each month, you're going to be down to 1,000 active patients. At least you've got patients. But let's look at this, doctor. We know from insurance data that annually in the United States, the patient value, what patients spend, is typically $800 over the year. So if you've got 1,000 patients that are active in the last 18 months, hopefully in 12 months, you've got 800,000. That's the goal, at least. Now, these people are active, but they might not have been in the first 6 months of this year, or, we're counting them 18 months back. Let's say, hopefully, and this is a number that you should know, doctor, your collections are at least, this is a low amount of collections, 94%, okay? Most offices in the United States have at least 60% overhead. We work with our clients to boost productivity per patient production in the hygiene department without working harder. And that equals no more than 50% overhead for our doctors when we work with them. Remember, I told you they're getting a 25% ROI when they work with us. The net to the doctor before their taxes, because they've got this overhead, is $308,000. Now, some of you you're zooming in from California. On $308,000, I think your state tax is taking like 14%. I could be wrong. I haven't lived in California for 20 years. I haven't lived in California. So they've increased that state tax since I left. State tax is probably 14% for this doctor. And then you've got your federal tax. So I don't know, maybe they're at 150 that they get to take. I mean, that's okay money. And some of you doctors might think that's great. I'm happy here. So be it. I'm glad that you're happy at 150. Look, you had 800,000 come through and only into your fingers went 150. I don't know. I'd like to have 300,000. I got to find a way to make 300,000, right? We all want at least 300,000 in our bank account annually, right? Now, let me show you something super simple. How and where do you find new patients? There's something that I know 99% of dental offices are not doing this. So let me just tell you some background history. Stay with me for a moment. Back to 2020, we were in a pandemic. People were locked in. There were shelters in place. People were working remotely. They were on their Zoom, whatever meetings, a lot of Zoom meetings. And people were looking at their smile and they didn't like what they saw. And I'm going to tell you that teeth whitening has soared from 2020 until 2026. It's estimated that we will sell $11 billion in teeth whitening. Now, that could be toothpaste, it could be mouthwash. But I'm telling you that Amazon, not dental offices, are selling millions of teeth whitening products every month. Yes, millions. Like I know one company, they sell over $900,000 in teeth whitening. And so I created my own teeth whitening product. By the way, back in 2013, I used to sell the teeth whitening syringes to dentists at wholesale. That's what we did back in 2013. And during the pandemic, I knew I had to get some new business ideas. So I created my own Smile Club with this. It's actually got red LED lights, and I'll show it to you later. But how can you tap into that? I'm going to tell you that taking impressions, having patients come back to pick up a tray, that has gone by the wayside, and that is a loss leader, because I want you to calculate how much time it's taking to get an impression tray right, mix up the alginate, or even if you're doing a digital scan, that's costing you money, right? And then your assistant's time, and then they've got to pour up the models, they've got to make the tray, and your patient's coming back. That is costing you more than if you offer your patient the Smile Club, where your hygienist introduces it and they leave with it that day. How do you get patients into your office? New patients on your website. And I'm doing this on my website. Maybe that's how you found me. I'm getting 10% increase of visitors to my website over the last 6 months because I'm working with a specific website company on search engine optimization. So I'm telling you from somebody, this works. Of course, I don't have new patients or teeth whitening, but I do have you that came to my website, right? So what's happening is I'm writing all the time about dental hygiene, services, systems, technology, and this subject is on my blogs. And then we keyword it. Same thing. You want more new patients? You got to have it on your website. You got to have it written inside the website, as well as your free whitening. And by the way, how can you give free whitening? It's buying it wholesale. And then I'm going to share with you just a little bit about that towards the end. But hygiene appointment, if somebody wants to make a hygiene, so cosmetic dentistry, okay? So then you want to have what's called a CTA, call to action, and ask us about our new patient special. And by the way, it's super important that you have a patient special now because we're running into the holiday season, right? We've got July, 4th of July coming up, and it's in the middle of the week, I believe. And so now your patients aren't going to want to come in. So offer them something special to keep their appointment. Offer something special. People are searching for teeth whitening. They're searching for whiter teeth. Ask your website people to tell you what are people searching for on the internet. And I will tell you, they are searching for either number one, teeth whitening or Invisalign. Now they're kind of similar searches, but I think your website people, and let me know if you agree, if they agree. Teeth whitening, people in your area within a 20-mile radius, you've probably got 20,000 searches already in the last 30 days for whiter teeth, but they're not landing on your website. Why shouldn't they? Every time somebody enrolls in the Smile Club, your hygienist is introducing that to the new patient. And some of you are having the hygienist see the new patient, which we'll talk about. But what if your hygienist is doing the smile evaluation and then your patient leaves with their whiter teeth? They're going to take this home. 15 minutes later, they're a few shades lighter. Most people are. And we have post-op care with them. So now I get these things sent to me. I've got a whole desk full of them. I save them. This one's $129 for new patient special. $129. They consider it a loss leader. Doctors tell me I know it's a loss leader, but you know what? You got to stop doing this. If you're in Newport Beach, if you're in New York City, if you're in Seattle, it's more like $349. That pays for your hygienist, because you're paying your hygienist at least $60 an hour, most of you. I know you are. And then they're going to leave with their teeth whitening, which adds another at least $100 net. And when they pre-schedule their appointment, remember I told you most new patients leave without scheduling their next appointments. They have to schedule at least their next hygiene appointment, preventive care appointment. And when they come for their preventive care in 3 months, 6 months, they get a free whitening pen. The pens are the way to go, not the syringes. The pens you paint on, and then you've got the prefabricated tray. Everything that I am selling is wholesale still, and it's my formula. Look at my formula on my website. You can see it under Practice Growth System. You search through that area, and you'll see my ingredients are a lot less toxic than most likely what you're using today. I digress. What happens when your patient comes? They should already have received and completed their forms. So you're going to have a review of medical history. You're going to have financial arrangements that payment is due at the time services are rendered. You need their insurance information. You also want to send them a smile evaluation. That's something simple. And our trainings, if you are in any of our trainings, it's a really big deal to me. It's you asking your patients what they like about their teeth or what they don't like about their teeth. What do they want to change? You need to know that when your new patient comes in the door, because now you know if they are going to tell you, I don't want to pay for anything I don't need, you know that money is their hot button. Some patients will tell me, I just want a healthy mouth. Others will tell you, I just want what my insurance pays. Some patients will refuse to complete the smile evaluation. What do you do? Well, your hygienist, if he or she is seeing them first, they're going to do a smile evaluation. They're going to ask them, where do you think you are? Let's get your shade down. We want to record your shade, because as we age, our teeth get more yellow, more brown, more stained. And let's at least get a color down documented in their records. I love working periodically. I work as a temp hygienist and I love it. Some of these offices, I've learned to scan the new patient. So when your new patient arrives, they should just have to check in. All the forms have been, sent to them. I get them all the time, guys. When I have an appointment, a lot of my appointments, even if you're getting your eyebrows waxed, you got to send, you got to fill out a form. And they're telling me that if I don't show or I'm more than 15 minutes late, I have to pay at least $25. Same thing. And they just click and then they finish, they click complete. And now it goes to your practice management software. So when they check in, you're marking them as an active patient and everything shows up. You should be able to see in your practice management software that all new patients need a full mouth series of x-rays, right? At least a panoramic x-ray and some PAs, right? At least. you know that they're going to at least get a prophy and a comprehensive exam. And we'll talk a little bit more about that. Who sees the new patient first? I'm not going to argue with you guys. I've been arguing with dentists many years ago. Who should see the new patient first? I'll tell you, people always want to know my opinion. I think they should see the doctor. And how is that going to work? I'll show you in a few minutes. But they came because the doctor's name is on the website. The doctor's name is inside the website. Maybe you've got the, Bayview Dental, and they came to Dr. Jones. They know that hopefully they know they're going to see Dr. Jones or Dr. Bill or, Dr. Goodtooth. Hopefully they've looked you up. They're coming to see the dentist. That's what they're thinking. And I believe that if you, doctor, want them to be a patient of record for the lifetime of your practice, you have to meet and greet them at the very least within probably the first 15 minutes of them being seated in an operatory in your office, at the very least. I'm going to walk you through the different ways you can do this, but that's my philosophy, is that they see the doctor first and that they have dedicated time with the doctor. And most offices tell me they want the hygienist to see the new patient first. Now, the problem I'm seeing is that these offices that are coming to us to do their snapshot and opportunity call, what they're telling me is their hygienist has an hour. And let's walk through that in just a few minutes, because I mean, this, you think that you don't want to waste time. You don't want this to be a lost leader. But I want you guys to know that your new patient probably costs you at least $500 to get them in the door. You didn't pay it outright, but it costs you a lot of money to get that new patient in the door. So let's take our time with them, make them feel cherished, like this is the best experience ever. These people really cared about me. Take your time, because it's penny wise, pound foolish to think that your hygienist sees them for an hour and you're doing a comp exam, full mouth series, and presenting more than just a few teeth that need to be worked on. So your hygienist's role, because most of you tell me you want your hygienist to see the patient first. And your hygienist's role is to build rapport with the patient, get to know them, find a connection. In fact, that connection, why are you choosing our office, should be asked on that first new patient phone call. Do you have a process for the new patient phone call? That's another thing that we, when people, offices work with us, we have everything at our fingertips to give you these resources. What happens when a new patient calls? So in your team huddle, you should be communicating to the team, this is Mrs. Jones coming in at 10 a.m. as a new patient. She chose our office because she just moved here from Texas. She now goes to Doctor's Church, and the church secretary said that Dr. Jones is a great dentist, a really nice person. That's why she came here. She just moved here and she's going to Doctor's Church. So your hygienist is going to seat that patient and say, oh, I heard that you go to Doctor's Church. Where did you live in Texas? How do you like it? They're building rapport, asking the patient about themselves. And in a few minutes, we're going to, in your handout, there are questions that your hygienist, whoever is seated with that patient in the first 15 minutes, is asking the patient. Data collection, taking their blood pressure, that needs to happen on the first appointment and annually. Many states, I think in the central states of the US, a lot of those states, it's a board of dentistry. Like, you are going to get fined if you don't have it recorded annually that you took the patient's blood pressure. So that needs to happen, as well as oral cancer screening. I call it an oral abnormality because we are not diagnosing oral cancer, right? So it's oral abnormalities, oral cancer screening. I love doing a scan. I'll take some video, I'll take intraoral pictures, take the x-rays, and then I do my CPE, the comprehensive pero exam. As the hygienist, I cannot start my treatment until I do that. That's my map. Does the patient have health, or do they have disease? And if a patient has disease, we know we are not going to finish their preventive care hygiene appointment where we clean their teeth. Okay. That's what's happening in the data collection. And we teach a specific methodology so that when you're collecting the data, you're helping your patient be a partner in discovering disease, and that helps them own the disease. Now, doctor is going to come in at some point and do an exam with the new patient when the hygienist is seated with them first. And now the hygienist is going to walk the doctor through all of the findings, rapport, the blood pressure. And now we're bringing doctor into the loop of what we discovered up until now. We're going to let doctor know Mary, Mrs. Jones, has moderate to severe gingival inflammation. We started treating her for gingivitis today. I'm using the laser. We're going to do laser bacterial reduction. I'll do a little bit of scaling, use my ultrasonics. I'm going to do a little bit of polishing, and I'm going to introduce her. She's interested in whitening her teeth. So I'm going to introduce her to the Smile Club, and I'm going to put some of the gel, the whitening gel, on her teeth. So your hygienist will tap the gel onto the patient's teeth with one of these little micro brushes here. You just put some of the gel. Well, I dip it. I go like this. I keep it in my drawer, or they have it out for me usually on the countertop when I'm tamping. And then I tap it on their teeth. I'm polishing. And then I go around here. At the very least, we're looking again with the patient, and I go, do you notice a difference? They're going to notice less stains. They're going to notice a little bit brighter, shinier smile just in a couple minutes. It does take at least 15 minutes of wearing the blue LED lights. And you can look this up. The nanometers in this are in the 600s, which is very similar to your Zoom light. Not much difference. So they're doing that at home, and they're leaving that day with it. So also, because your hygienist has discovered the value this patient wants for their smile, you know that they want a healthy mouth. You know, as their hygienist, that insurance is driving their decisions. Now you'll speak to that patient. If money's the issue, you're going to say, Mrs. Jones, everything looks great except for those areas of moderate to severe inflammation, to put a halt to the disease, to put a halt to the inflammation and infection that's starting. I'm going to see you in somewhere between 4 to 6 weeks. I'll reevaluate. I'll do the laser treatment again. I will do more of what we call scaling to clean your teeth. And at that time, we'll reevaluate. Should you come in 4 months? Should you come in 6 months in the future? Most patients, I'm explaining the mouth-body connection, the importance. And I'm saying because they only need one more hygiene appointment, we hope. And then I'm going to say, this is June right now. I have July 31st. I know you like 10 a.m. Got 10 a.m. How does that sound to you? I'm in charge of my appointment schedule. I offer the patient a time, or I can at the very least say, do you want morning or afternoon? And I'm in charge of my appointment schedule. Super simple, but this is adding value all along the way, from rapport to bringing the patient into owning their disease, connecting it to the doctor, and the patient's hearing the same words again, doctors saying the same words: infection, inflammation, disease, hole in your tooth. And then I'm again motivating the patient with inspirational words that paint they're words that paint 1,000 pictures. Everything you do must benefit your patient. So at this point, how many new patients does a typical sustainable dental office need? You need to have at least, I would suggest that you shoot for at least 15 new patients, because that's going to keep you sustainable. That's going to give you at least 100, and it's going to be over 150 new patients, more like 180 new patients a year. And remember, you're going to have a 10% attrition. So how and where can you find the best new patients is through your website. Whatever it is, ask your website people. SEO does not, search engine optimization does not need to cost you a lot of money. Speak to me. I'm not getting paid to help you. with who to use, but I don't pay a lot of money for SEO, but it's all the keywords. Some of you came to my website and saw this. That's why you registered. And so the same thing needs to happen with you. And I'm just telling you some information. What are people looking for? What are they searching the internet for? Invisalign. And most people are searching for whiter teeth. So why not have them find your website? Cost-effective way, easiest way to get patients to schedule a new patient appointment. Reach out to me. I've got those slides. I can send you the PowerPoint slides of what to have on your website. You need a call to action for new patients, and you can switch your offerings up. You're coming into the holiday season. We've got 4th of July, we've got Labor Day, Thanksgiving, Columbus Day, not in that order, and then Christmas and New Year's. So people are going to be calling to cancel. They're not going to want to come in. So have a special that month. It could be Invisalign special. This week, we have an Invisalign special. Get X amount off. We have our Smile Club membership. It's X amount off. So you can, maybe you're getting an ROI on that Smile Club membership, not 125 like most offices. Maybe it's 75, you reduce it. Maybe you give them some extra pens, ask, I know, right now we have a 4th of July special, ask us how to get free whitening. That's what you're sending out to patients who need appointments right now. By the way, talking about this topic, be sure you register for July because we're going to be talking about reactivation. What we talked about, the hygienist's role in the patient process. It's rapport, it's connection with the doctor, introduction, and then it's also motivating the patient to come back, getting patients to own their disease so they want to come back. So always make sure that every single patient schedules their next appointment. And with the snapshot, I'll show you if you can, if you have Dentrix, EagleSoft, or Open Dental, I can do a snapshot for you and show you how you're always seeing doctor. It takes that long to log in and see yesterday who left without a next appointment. There's somebody in your office that needs to see that and get those patients back on the schedule. You want to make sure that these things are happening that we just talked about with the new patient appointment. This is the way, like I'm telling you, the Smile Club, I've been doing this system since 2013, 2010. I can't remember exactly, but it is a system that keeps patients on your schedule. Number one, it will reduce those last minute cancellations. So as many new patients as you can, do the smile evaluation, find out what they want. Remember, they're going to most of your patients want, most of them are going to want a wider, brighter smile. So the Smile Club helps increase your per patient production through the hygiene appointment because it takes not very long to introduce it. They leave and your net is 100 to 125 from the hygiene appointment and your new patient appointment. And yeah, so anyways, I digress. This is the patient loyalty program. New patients, you want them getting enrolled in your Smile Club because it keeps them on the schedule. It's what's in it for me. They're getting a free toothbrush, but what if they got a free whitening pen? These whitening pens, you go to Amazon. I know that maybe you can buy some for $5, but I'm sorry, I'm going to swear. I'm going to say a bad word, okay? So close your ears if you don't want to hear, but there's a bunch of crap in here. And I made mine as clean as possible. It even has potassium nitrate so that there is no sensitivity. There's xylitol in there. Xylitol is healthy, okay? Some of these big names that you're using for your teeth whitening have sucralose. Oh my gosh. They have other words that are toxic, carcinogenic. So anyways, these we sell at wholesale, less than what you're probably paying right now. So just want to let you know the patient loyalty program keeps them coming back, gets them to pre-schedule their hygiene appointments, and it reduces the cancellation. So think about that. And then it's something that you can promote on your website for your new patients. Ask us about our new patient special and your patients of record. They can enroll in it as well. So this is what you get. The red LED lights are really great. And some of our clients do sell the mouthpiece for their patients who get mouth sores. They sell just the mouthpiece to their patients alone. So everything I've been talking to you about so far will bring you more money. Like I said, most offices, like if you take this back and implement it, there's no way that you're not going to get $1,000 more production over the next year. Think about one thing you're going to implement that you've learned thus far. If you want to fast forward things and not work so hard, take advantage of the 15-minute call and the snapshot that it can do for you. Because I can fast forward you without running on a treadmill, but imagine 25% more money in your bank account in the next 12 months. That's what our clients get. Anyways, let's talk about this 5-step process. With your new patient, you're going to be asking some questions. You're not grilling them, okay? But you're asking questions that just are giving a conversation. It's just a back and forth conversation. When you ask your patient something, listen. And then you're going to connect them with the doctor. And I suggest doctor knows that there's a new patient coming in. This is something I'm really a big advocate for your team morning huddle. And we teach you how to do this. You get it down to a science in 10 minutes. And I don't care how many clinicians you have. If you can have 4 doctors and 6 hygienists, we're going to get you down to 10 minutes of, because your team is driving their opportunities. And the doctor and everybody knows there's a new patient coming in. Doctor's assistant knows a new patient's coming in. And at least the assistant can direct doctor to quickly say hi at the beginning of that new patient appointment. By the way, some states, you can tell that I'm by the book, right? Like I used to be a hygiene program director, and I'm like a rules person from a young age. And, you know, some states, their board of dentistry requires that doctor tell the patient they have to prescribe the x-ray. So it is important that doctor come in and say hi and let them know, oh, Debbie's going to be taking some cavity detecting x-rays that allows me to look at the bone and, you know, other areas of your teeth and your gums. And if there are, and if there's anything abnormal, and I'll be back in like a half hour to do an examination and we'll get to know each other better. When they come to do the exam, when doctor comes to do the exam, if I'm your hygienist, I'm going to make a formal introduction. I'm going to let you know all the answers to these questions. Like, oh, Mary came in today because she's new from Texas. She just started going to your church. Oh my gosh. Now that gives doctor a great in conversation to talk with about the patient. And by the way, we don't want doctors staying there forever talking. And doctors got to know that. You guys got to train your doctor not to stay forever. But now they're going to deliver the important message. And because I'm the hygienist, I've been saying inflammation, infection, looks like you might have a hole in your tooth, looks like bacteria sneaking in around this tooth. Now I'm going to tell doctor the same thing with the same words, because it takes a while for patients to really absorb the information. And by the way, look at this posture here. Debbie's on the other side of the patient and doctor's here at arm's length away. This is called proxemics. And it's super important that doctors seated upright with the patient. Let doctor, if doctor's going to talk to the patient about treatment needs, you got to let the patient sit upright. Why? I know, doctor, you're busy. You got to run back to your patient that's waiting for you to start that crown prep. But this is where we process information in the frontal lobe. And if we're lying back like this, what is the likelihood that we're understanding what you're saying? And it also builds rapport. So you can see eye to eye, knee to knee. And then I'm on the other side delivering the information. So it makes the patient feel safe that there's a triangle going on here. My job as the hygienist is to motivate the patient. And I'm delivering the information to doctor. And doctor's like, yes, Debbie's right. You know, I do see the hole. There is bacteria sneaking in. And here's urgency. Doctor's word is God's word. And doctor's going to say, you know what? I see more things going on. What I'd like to do is get you back next week. Urgency next week. I want to put a halt to that bacteria sneaking in. Debbie's got to see you again as well. But I want to see you next week to get started on those 2 teeth on the lower left. Let me show you. Doctor's going to go to the scan that I've done. Doctor's going to go to the x-rays that I've taken and point these things out to the patient, Mary. And when I see you next week, I'm going to meet with you in my private consultation room. And let me walk you through some other things that are happening in your mouth. Because doctor, even if we've given doctor his own 30 minutes with this patient, that might not be enough. And even if doctor did deliver a full treatment plan that's going to be over $1,500, it's hard. I'm telling you, I do this all the time for the last 24 years. I'm telling you, when we get to $1,500 in a treatment plan, patients start glazing over. So we got to take our time and we got to get to know them and deliver it in small pieces, small bites of information. In fact, I hope that you're taking copious notes because I'm giving you as much as I can right now. And how much of this can you digest? And then can you deliver this to your team in a timely manner? And how much can they digest? Here are important questions, and I want you to fill in the blanks here. Why did you choose our office? Now, that's a question that they should have asked on the front desk, at the front desk. And this patient that we're using as an example chose this office because she's new. She just moved from Texas to California. And now she goes to the same church as doctor and the church secretary. Oh, Mrs. Campbell, she's the best. I love calling the church and she's so sweet to me on the phone or, whatever that is. Doctor knows. Let's remind doctor, because maybe he's got so much going on in his mind or she's got so much going on in her mind since we had the team huddle. She doesn't remember. How did Mrs. Jones get to her office? Oh, so Debbie's saying she came because she goes to your church. Mrs. Campbell, the secretary, told her to come here. Oh my gosh. Why did you leave your last dental office? And if I am the hygienist asking, I'm gonna say, the reason why she left is, as you know, doctor, she's moved here. I don't need to say the answer again. She chose this office. She just moved here from Texas. Mrs. Campbell told her about her office. Well, Mrs. Jones, what did you like about your last dentist? What did you like about that dental office? Let her talk. This is an opportunity. Many patients are going to say, I hated this. They screwed up the insurance. They said I owed $15,000. I should have never had to pay that. Let them rant, but not taking too much of your time. They've already told Debbie, your hygienist, about it. What's important to you about your dentist? Here's another thing. You're going to learn what's valuable to them. I do not want my dentist to do anything more than my insurance pays. I just want to have a healthy mouth. I want to have whiter teeth. I want to have straight teeth. Let them speak because now you know what they want. And people are more likely to pay for what they want. What is the goal? Oh, Debbie said she did the smile evaluation and it looks like you want Invisalign. Looks like you want whiter teeth. Great. It looks like Debbie's going to set you up with the Smile Club. That's great. By the time I see you next week, you should be on your way to much whiter teeth. Here's the important question. Now this is not on here. I want you guys to write this. This is super important. One important question is, and this helps you to deliver a message that kind of eases your patient. They've given you permission. It's like my husband. I need to tell you guys something. A first date, he said he wanted to ask me something important. I was like, oh my gosh, true story. I was like, what does he want to ask me? I'm just thinking the worst. And you know what he wanted to know? Could he kiss me? Seriously, true story. So it's like, we want to ask our patient, not if we can kiss them, but if we see something which is as intimate and could get so upset like me, if there's something we see that's abnormal, if we see something abnormal, do I have your permission to show you and talk about this? This helps them to own their disease. They're less likely to be upset that you told them they need this big treatment plan. In fact, I don't suggest you start telling about 13,000. My friend just went to a new dentist here in Arizona where I live. She just moved from Oregon to Arizona and they gave her a $13,000 treatment plan. She's not too happy. 2 years ago, she paid $20,000 cash. Now she has dental insurance and they told her it's 13,000. I mean, take it slow with them. Ease them in. Let them know you've got this. It's our primary concern. Let's start it next week. And when you come in, And doctor, if you don't want to take the time, you've got to have a treatment coordinator that's competent, that doesn't have issues around not spending a lot of money. And they need to get that patient into the consultation room and walk them through what we see and understand. We already know at their first appointment, what is their value point? Are they going to be insurance driven? Are they going to have financial issues? And your treatment coordinator, your financial coordinator, they need to work together to help the patient get what they need and be able to pay for it. That's where flexible financial arrangements come in. That's where phasing treatment comes in. So I am not going to tell you how much time you need for your new patient appointment. And I'm not going to tell you who you think should see the new patient first. That's your practice philosophy. If you're coaching with me, I'm going to tell you this is what I recommend. This is how it's the best. I'm going to ask you to be open to trying it at least 3 months, doing the new patient exam this way, because I know seeing the doctor first is going to bring in more money long-term down the line. And we want our patients to remain in your practice long-term. So let's walk through this. Your hygienist, now I'm going to be adamant, your hygienist cannot spend 1 hour with the new patient and doctor do the exam. It's not going to work. And if you want doctor to do a separate exam, I'm going to show you the benefits of the patient seeing the doctor first. Okay, we'll talk about that in a few minutes, but here's 90 minutes. It's 25 to 30 minutes for me to establish rapport, get to know that patient. That's like 2 minutes. And then I'm going to do a smile evaluation, which they've already completed, but I'm going to review it with the patient. I'm going to hold up a shade guide and we're going to take a shade. I'm going to do a scan or a video. I'm going to take intraoral pictures. I love intraoral video if you don't have a scanner. I'm going to do an oral abnormality screening, and I'm going to tell my patient all along the way what I'm doing. I'm checking for any bumps, lumps, checking the soft tissue in your mouth, checking the hard tissues. Now I'm checking the floor of your mouth, your tongue. Everything looks great. Now I'm going to check the health of your gums. That's the CPE. And I'm going to call out the numbers, and we have a specific process that we teach our clients so that your patient is part of this process. They're a partner in these abnormality screenings. And then at the very end, they're more likely to want what they need. This is motivational when you create a partnership with your patient when you're doing these exams. Okay, so doctors should come in at this point somewhere in here. Doctors should come in because, like I said, it's possible that it's your board of dentistry legally. Doctor needs to come in and say, we're going to do some x-rays. We're going to do these x-rays. And you know, for those patients that are saying, I don't want x-rays, it's God's word when doctor says, my doctor, I never get cavities, knock on wood, never get cavities. I haven't had a cavity since I was 17, which was just a few years ago, as you know, but wink, wink. You know, my doctor said, it's been over 5 years. We've got to do an FMX. I'm not going to see you as a patient unless you do the full series. And I'm a dental hygienist without ever getting cavities. He was adamant. And you got to be the same way too. Otherwise, it could be a supervised neglect serious problem. Okay. And then this is where if I see anything abnormal, if I see a hole in the tooth, if I see moderate to severe gingival inflammation, if I see the start of gum disease or gum disease, I'm going to sit that patient up like I showed you in that other picture, and I'm going to walk them through what I see. Now, if I created that partnership while I was doing my abnormality screenings, the patients kind of bought in. They heard the bleeding, they heard the fives, and they already know what that means. So they're like, oh no, it didn't sound good. I'm like, no, but let's create a plan so it looks good in the future. Let's put a halt to this. This is my time to shine as their preventive care specialist. And then I'm going to have a few minutes. Now, if it's a healthy patient, I should be able to finish up in the next 20 minutes, right? I shouldn't have a lot of scaling to do. But if I see that they have gingivitis, maybe they've got a lot of supra and they don't have much gingivitis. Maybe they only have like a lot of heavy supra and a few areas of bleeding. because it's been 10 years. I'm sorry, patient, but it's been 10 years. We got to play catch up. And you know what? The financial coordinator is going to tell them next time they come in, it is going to be a routine cleaning. That happens every once in a while, and they do have to pay out of pocket. I'm the hygienist saying, I know it's been 10 years, there's no serious problem, but we want to put a halt. We want to stop and eliminate any chance of serious problems. And I'm going to suggest that as soon as possible, you come back. I do need to work on this again. So I think it's important that you identify, is this a healthy patient? And if they're not healthy, you're going to be talking to them about coming back again. If it's gum treatment for quadrants of scaling and replaning, 1 to 3 teeth of scaling and replaning, 2 appointments of that, you let them know that the front is going to talk to them about financial arrangements. They'll do their best to get insurance to pay for it. And they also are going to schedule their next appointments. So doctor has only 10 minutes at this point. Even in the 90 minutes, doctor only has 10 minutes. So that's why I'm telling you, doctor needs to decide on what's phase 1, the main priority, get them back next week to start on that. And then either doctor meets with them and has a consultation and walks them through the full treatment plan, or the treatment coordinator and or financial coordinator walk them through that. Now, the new patient sees the doctor first, 30 minutes, still kind of tight. Your assistant's going to seat and go through that same process. Doctor needs to meet and greet real quickly, and most likely doctor needs to come in and say, we're going to take these x-rays or cavity detecting. They check for any abnormalities, and my assistant Mary's going to take those x-rays. She's going to do a video of all your teeth, take some pictures, actual pictures of all your teeth, and we're going to do what's called a scan. And then I'll be back to talk to you more about any abnormalities, anything we see, and we'll walk together through this. And then I come back as the doctor, I come back and I do my comprehensive exam. I want you guys to see the ADA has documentation. Like I said, I'm a rules person, and you have a list of everything, and I'm walking you through, doctor, like it's TMG, it's occlusion, and it's even now ADA has one of their standards is sleep apnea. And I train hygienists what to look for, the neck, their tongue, the palate, there are different areas that even your hygienist can be looking at if they're seeing the patient first. I like to give the doctor a heads up. Maybe we need to do a sleep study, doctor. I just want to let you know. So then doctor is going to just spot probe. Your job, doctor, is to decide, are they healthy? No gum disease, no radiographic bone loss. It doesn't seem like we have moderate to severe inflammation. They're either gingivitis or they're periodontitis, or they're healthy. And doctor, you're going to build up your hygienist. Debbie's our expert. She's a preventive care therapist. This is what she studied. This is what she's been doing. It's what she eats, sleeps, and breathes. She's our expert on that. She's going to do a comprehensive exam on your gums today. She'll call out some numbers. She'll explain it all to you. But it looks to me like you need more than just a standard cleaning. So today she'll start the examination of your gums. She'll start to do what I want you to have is our laser. And the laser is a red light that actually gets to, you might have heard, the powerhouse of the cell, the mitochondria. And I have this whole explanation on that I teach. But you want it, doctor can, introduce that. We're going to do that today. And they're going, is that an extra charge? That's your own philosophy. There are some offices that are including that. And by the way, if you guys don't know, that the CDT codes have a new way that doctor can bill for, not a comp exam, but I'll just tell you quickly, 140. And then I'm going to do my gross debridement today. So those two can be paid for together, where before doctor wasn't getting paid for it's a whole nother webinar I could do. So you're building up your hygienist and letting the patient know and that Debbie is going to do a more thorough exam, but it appears this, okay? And we're going to get you back. I need to see you next week. Debbie is going to start today, but I know she's going to get you scheduled for quite a few more appointments to treat your gums. We want to put a halt to disease. Remember, I told you, doctor is like God's word. So benefits here. Hygienist sees a patient after. Here's why. I know a lot of hygienists. When I'm temping, I hear the other hygienists going, I can't see them because I don't have enough MX. It's already taken. We're ready to go. Doctor has already built me up and told the patient health or disease. Doctor is telling them I'm a preventive care specialist. I'm the expert on treating gums. And doctor is telling them we're not just cleaning your teeth. Doctor's telling the patient, at our office, what my main concern is your total health. I've seen some moderate to severe inflammation. Have you heard of gingivitis before? I'm sure you have. But we're going to put a halt to that. And we have a laser. It's pain-free, but it actually zaps the bad bugs in your mouth. In fact, it boosts the powerhouse of your cells, not just in your mouth, but in your body. And Debbie's going to use that today. I highly recommend it. Doctors setting everything up, and patients are thinking, oh, it's God talking to me. It's God talking to me. And they're not God, but yeah. So, what are you guys thinking of? What are your main questions? There are so many pieces of this puzzle, and there's a lot that I've given you right now. Hopefully, at the very least, you can schedule a team meeting to go back with your team. I really love what I do. It's something I've been in dentistry since I was a teenager. And 24 years ago, I started working as a coach, consultant, and spoke at all the national dental meetings. I started out in Canada. Not that I'm from Canada, but it was like I wasn't an expert in my own backyard. So Canada had me come in there and speaking. And I started out speaking 24 years ago on the mouth body connection. And it's changed so much. I love that topic, but I really enjoy helping you and your team understand how to speak to your patient with these words that add value and a benefit to accepting your care and continue returning to your office because they believe that your office is the very best they've ever been to. Now, here's the situation. I know that cancellations are on the rise. It's just a huge problem. And this is where I started with these syringes. Doctors in the first pandemic in 2008, all the way up until 2015, they were calling me saying, Debbie, help me with the hemorrhage in my schedule. And that's why I created this situation with a system around the teeth whitening. These syringes, they had to make the trays, but they came back and picked up a syringe with their tray. That's out. Don't do that anymore. It costs you a lot of money. And so this is the Smile Club that helps. The number one benefit to you is helping to reduce these cancellations and keep patients returning to your office because it's that what's in it for me syndrome. We're going to be talking a lot about reducing cancellations, reactivation, keeping patients on your schedule. It's the summertime. Reactivation is super important to start working on now before the end of the year. We know that 50% of patients in the United States leave their dentist without scheduling their next appointment. So this time up until now, what I'm sharing with you is the new patient because this is the time that you pull out all the big guns, give them your very best. You're on the first date. Make it the best and get these patients to trust you, to love you, to be your raving fans. And they will want to keep coming back to your office. They should leave with at least scheduling for that one quadrant of dentistry to start next week. And then go slowly with them. It's hard for them to digest all this information. Maybe they do need $13,000 treatment plan, but go slow. This is the most important area. We want to start here. Okay, so you've got a patient that said yes to coming back and make sure they always leave with the next hygiene appointment. Okay, this starts your new patient. You're starting on the right foot with your new patient. What are your next steps, guys? Like, have you written down a date that you're going to meet with your team and take this back and start implementing? Well, I put something together with you. It's the office snapshot with an opportunities call with you. If you have open dental, Dentrix, EagleSoft, I can quickly look at those numbers. You just need to schedule an appointment, book an appointment. Lori will talk to you about that. We'll get you set up and she'll schedule that time with me. At least look. If you do not look, you're blindfolded. If you don't know those numbers that I've been asking you about, if you don't know them right now, doctor, you need to know them. You need to know what was collected yesterday. How many patients left without a next appointment? How many patients need a next appointment over the last 18 months? Who needs a next hygiene appointment as of 6 months ago? What are those numbers? You need to just inspect because you expect success, right? And so that's what I'm teaching you. So nothing ventured, nothing gains. I'm telling you, I can confidently tell you, our clients, they do work with us for a year. Lori can tell you what that looks like, but they have a 25% return on their investment. It's huge, huge. And you'll see that on our website. So all who book their snapshot, I want to tell you, so a lot of people are reaching out. The end of the year gets busy for us, but I'm very customized in what I do. I don't take numerous people, but we do have a program right now, which is a hybrid. It's mainly online with Zoom coaching, and we have 4 spots left right now. Well, maybe it depends on when you do, but do inquire. You can book a time. You can, if you don't see anything, when you scan this QR code, if you don't see any available times, because I am busy, give us an email, okay? admin@dentalpracticesolutions.com. Here's what you write in the subject line. This makes us know, oh, this guy, this lady is a dentist. It needs to be the dentist that we're meeting with. You can bring somebody else along, especially your spouse or other decision maker, but they need to be a part of the opportunities call. The doctor does, and the other decision makers. So write 1 and 4 hygiene off, and then provide us with 2 different days and time. Please tell me your time zone, your best phone number to call you at. Don't just give us an after numbers phone number, please. Like, it's best if you can let us be in touch with you, doctor. Don't go MIA, because we're all so busy. And we're like you. We don't want you to no show or cancel last minute. I'm just like you. You don't like that when your patients do that to you. We want you to be fully present with your video camera on for that Zoom discovery call meeting with me. Let me know your email. Well, you're going to email, so we'll know it, but we will respond to you with a day and time. We do take Friday afternoons, Saturday and Sundays off, and then we're full speed ahead on Monday morning. What questions do you have? I'm going to give you a chance to send in some questions in the chat. And if you're not watching this live, if you're watching it later, or you can't, if you've got questions, do email us admin@dentalpracticesolutions.com. It's on your handout here. Send your question. Just say Power Hour question in your subject line and ask your question. We really do respond. Okay, we've got a question. This is funny. This is one of the team members. It says, my doctor talks with the patient during the exam and offers them discounts. Oh gosh. Okay. Well, an easy solution to that, I will tell you, is okay, doctors cannot talk about financial arrangements. Let your financial coordinator handle that. And you need to have somebody, doctor, that's confident in talking about money, that can offer flexible financial arrangements. Doctor, if somebody asks you, a patient asks you how much, you let them know. Mary is at the front. She's my financial coordinator. She's the expert on this. I'm going to defer this question to her. Okay. Simple, short, and sweet. Doctors do not discuss finances in the operatory. One thing I want to tell you is a story about Care Credit. They told me the story. Care Credit had to reimburse like probably $20,000 to a patient who was seated in the operatory with the bib on. And somebody, the financial coordinator, came in and started talking to the patient about their treatment that really was necessary. And then the patient agreed to it. Well, I think they had buyer's remorse, and they actually had a lawsuit going, and Care Credit had to pay back the money. So they filed a lawsuit saying that they felt coerced into accepting the treatment because they were seated in the operatory with the bib on. So that's why it's really important to have a nice conversation with that patient, especially in a private area, consultation room where nobody else can hear. the conversation, make it private, even if you're at the front desk. And, I've worked as a hygienist for many years, and we didn't have a private consultation room. So at least they took them in a private area of the office and they walk them through the x-rays, walk them, make it comfortable for your patient. Remember, you want to do something they've never had before. Make that personalized. Okay, so do we have any more questions here? So they're asking about the smile evaluation. My patients say there's nothing they want to change about their smile. What you recommend we do? I recommend that every patient at least annually do a smile evaluation. And if they decide that they're not going to answer the question, that's fine. But do take a shade guide and document it. Take a picture of it. And now it's part of their clinical record. When they're looking, I've actually had this situation happen where patients were like, no, I don't want this. And the other thing is, I would recommend, the Smile Club is a really great way to easily increase per patient production, because you're going to net $100 to $125 every time somebody leaves with the Smile Club and their whitening. So that increases your net per patient production, especially in hygiene, when we know that's a huge problem because hygienists are getting paid more than ever. But it also reduces cancellations because patients are asked to call during business hours. There's a whole, they have to, in order to get the free pen, they have to call during business hours to cancel their appointment or change it. And also, they need to schedule their hygiene appointments. So then they get this free. So getting patients enrolled in the Smile Club is huge to you. It's not just more money per hour, but you're going to reduce cancellations, and you're going to keep patients on the schedule. They're going to pre-schedule hygiene, or hygiene schedule is going to be full. Okay, so what else do you guys have? I know you guys have been here. I know your time is valuable. You can't get back this time. I don't even know how long we've been here, but I try to make it short, sweet, to the point. I know that it's hard when you come to these courses. Maybe you're listening to it after the webinar, after the fact. So maybe you got interrupted during this time. Reach out. I mean, I just really love helping you. I love seeing doctors and the team stop working so hard. And I know dentists are really challenged with high overhead. So I will see you on the other side. Be sure you register for our summer webinars. We're talking about reactivation, reducing cancellations, these type of things. Be sure that you reach out to us. It's the easiest way to get things going in the right direction. Whether you just do a discovery call, opportunities call, a snapshot, I'm happy to help you in any way. So this is our July. Make sure that you register. The link should be live. And I thank you so much. Make it a great day. Make it a great evening, whenever you are. I appreciate you.